Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about the importance and benefits of patient recalls. Maybe you already have a really good process in place of ensuring that patients are seen when they are required to based off of previous assessments and visits, or maybe you're a new practice and you're trying to figure out the best way to do this. Any way you are, whatever situation you're in, today we're going to talk about why those patient recalls are so important. The two biggest factors are revenue generation. Yes, ding, 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 revenue, and practice sustainability. This is going to help you be able to really focus on patient care while you can stay in business and try to make a little extra money at the same time. I have put together 7 points of why patient recalls are so important, and I want to go through those today. I know there could be other points to make, and I'm not saying this is an all-inclusive list, but it's definitely something that should get the motors, the wheels turning in your head going, oh, we don't do this yet, or I haven't thought about this yet, or I've been meaning to implement this and I haven't had time. I'm hoping this motivates you to do it, okay? So I'm gonna go through the list. One of the biggest benefits of recalling patients and having a regular standard and process of doing so to protect gaps in care. Patients are going to be lost to follow-up, as you would say in medical terms, if you don't have something like this set in place. So if they have chronic issues, if you're really trying to push preventive care to prevent chronic issues, this is where this plays a really strong role. It also helps prevent missed appointments. It captures and will help with repeat visits, and it keeps treatment plans on track. It is in the benefit of the patient ultimately. That's the number one thing that you need to keep in mind. I know it's hard, especially in small practices, because of the limited amount of staff that you have, but you can use your technology to your advantage. And actually, I'll be doing a video in the near future about ways that you can try to recall patients, okay? But today we're just talking about why recalling patients is so beneficial. The next thing I'd like to point out is the stabilization of visit volume in your practice. So if you are relying solely on new patients, this is going to be really difficult to try and put a budget together to anticipate your revenue coming in. But if you can get those regular follow-ups, 3-month medication reviews, the annual physicals, any of that lab work even, you're going to be able to build a steady stream of appointments to fill your schedule and also to rely on that steady income at the same time, okay? Especially during like the summer months in a lot of practices, it seems like those are the slower months until right before school starts, and then everybody kind of like rushes to the doctor to get things done. Again, depends on your specialty and where you're located. However, there are times of year that it's a little bit slower. So this definitely helps bridge that as well. The third item I'd like to talk about is it boosts your billing opportunities. And you might be going, what? I don't understand. Well, when people come in for follow-ups, they usually need something else to happen on top of that, right? Whether it's a venipuncture code you get to at least bill for. It's a few dollars, but it adds up. If you run labs internally though, and you can bill for the running of the labs, that's additional revenue. Imaging, if you do x-rays internally and they need x-rays, you get to bill that out, right? It's not just an E&M. You have some of those add-on additional services that you would be able to bill for. So without the follow-ups, these services and revenue would be lost. Improving your quality scores and incentives. This is something that if you're participating in MIPS and HEDIS and things like that, you're going to be held accountable for your different measurements that you've chosen. So this is going to help you increase your incentive payments, which is additional money essentially, right? It's going to get you better paying contracts with your payers eventually when you can show them how strong you are with meeting your expectations or exceeding your expectations when it comes to these metrics. And they will be more enticed to give you better rates if you can show consistency in that. And then you're going to avoid penalties. So you're going to have to, you can avoid losing money because you have a regular recall process to show them that you are taking patients' care seriously. Now, obviously, if you're doing value-based care, which we've talked about, it's all based on patient outcomes. Your reimbursement, it's not fee for service. So you really want to make sure you're staying on top of that, because the more on top of patients, the more on track they are with their treatment plans, the better outcomes they're going to have, the more satisfied they're going to be, and that will also play into your pocketbook. You're going to reduce no-shows and patient leakage. Patients often forget or misunderstand why they're due back to the office. Like, they don't understand because they're thrown so much information at once that they either forget that they need to come back and they don't ever schedule. So it's definitely on you to try to help them remember that, right? And if they've already scheduled before they left, then you're calling to remind them of their appointment, which is already scheduled, which is good. And sometimes they don't understand why they need to be seen again. They'll be like, yeah, they said I need to be seen, but I don't understand why, so I'm not going to do it. Well, that's where your staff can come in and help as well. And then this whole system will proactively track and remind patients to reduce the no-show rates, like I said, because that's lost revenue. That's a spot that someone who would have been seen and had money revenue generated is blank, right? It's going to keep them loyal to your practice because they're going to see that you care about them, and they're going to see that you're proactive, and a lot of people appreciate that approach. And it's going to prevent them from seeking care from elsewhere, which is very important as well. The second to last point I want to make is that it supports preventive care revenue. Remember, annual wellness exams, a lot of the add-on services that are associated with that do not get applied to patient deductibles. They are covered at 100% as long as they see in-network providers. And that is guaranteed money in your pocket. And you don't have to deal usually with referrals, and you don't have to deal with any kind of prior authorizations, depending on your specialty, of course. But take advantage of that. If you're in GI and people need their colon screenings, you can take advantage of that. There's a lot of different specialties where the annual screenings at the no cost out of pocket to the patient is an incentive for you to help them take advantage of that. It's not just primary care or internal medicine. It will also help your malpractice defense. If someone were to follow or file something against you for malpractice, you can show them that you have a recall system and that you try to stay on top of everyone. And it's just the way your operations works in your office. So it would actually fall on the patient if something fell between the cracks, most likely. You would pass risk management audits because you're asking people to come in on their regular intervals for annual wellness to try to be proactive. Again, this keyword I keep using, if you notice, proactive, to make sure that you don't let your patients with chronic illnesses get worse, or they can improve them, or people who are healthy, you prevent them from developing chronic illnesses. And then you get that accreditation a lot of times with this through the NCQA and the PCMH and all of that. So if you're looking at maybe trying to become accredited as a primary family practice home, what is it called? Primary medical home. I always forget what it's called. But if you want to become one of those, that's really important. If you're trying to become an FQHC or an RHC at some point, this is definitely going to be things that they're going to be looking at. Making sure that you have everything documented the SOPs, the workflows, who's responsible for what part of that workflow in your practice, that your staff are being held accountable and someone is checking to make sure they're doing what they're supposed to be doing, auditing to make sure patients are scheduling for their follow-ups and everything. That is going to be the number one key. You could have something set up, but if nobody makes sure it runs and it's running efficiently, then it's kind of worth for nothing. So make sure that you have someone who is responsible for overseeing this. It's getting done, people are doing it appropriately, and patients are scheduling. Those are going to be how you can make this successful for you. So in summary, a patient recall tracking system is going to be a revenue engine as it keeps patients engaged, which is good. It maximizes your billing. It drives quality performance bonuses and supports predictable scheduling and staffing, which is good too, because if you overstaff on a light day, you're losing money, right? But if you can appropriately staff and only pay what you need, another revenue booster, okay? So if you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. I appreciate the support, and we will see you next time. Bye-bye.